Hello, my name is Dr. Tiffany Hodges, and I'm a neurosurgeon here at Case Western University Hospitals and Cleveland Medical Center. This is a 67-year-old patient with multiple medical issues who presented with headaches, blurry vision. He had an MRI of his brain which revealed a right temporal enhancing cystic brain lesion. As you can see, this tumor is intimately involved with the ventricle and also the MCA branches, in addition to being surrounded by important cortical and subcortical fibers. In this case, we were able to use SyncAR to delineate the ventricle and the MCA branches, as well as the white matter tracts. We could use augmented reality to measure the distance from these structures to the tumor. So included here is operative footage of the tumor resection. As you can see, there's a temporal lobe tumor. And here we used SyncAR to delineate where M2 branches were, as well as the ventricle, and be able to measure the distance from the tumor to these critical structures. As we deepened our resection, we used the stylet to identify the distance to M2 here, as well as identify the distance to the ventricle as we got deeper into the resection cavity. So the use of SyncAR in this case was especially critical in identifying the location of critical structures that were either intimately involved with the tumor or a short distance away. In particular, the ventricle, the MCA branches, and the white matter tracts. Once we could identify the distance, we could continue our resection and continue to measure the distance to the MCA branches and measure the distance to the ventricle as it was intimately involved with the tumor. The use of this SyncAR definitely provided another modality to be able to identify how far these other structures were in relationship to the tumor as we were resecting the tumor. We could be able to predict the distance to these areas in relationship to the tumor while being safe and being able to take out the tumor in a circumferential perilesional fashion. And we were able to resect this tumor en bloc while protecting the ventricle, the ventricular wall, and resecting the tumor in one piece.